HIV and AIDS is today's presentation, presented by Alan Truong and myself, Fernando Rodriguez. This is for the Human Sexuality class 425. It will contain a lot of information about HIV and how it evolves into AIDS. First things first, the rising epidemic. In the early 1980s, physicians started seeing an increase in a deadly disease known as HIV that was responsible for the breakdown of the immune system. Back then, it was a common misconception that AIDS was limited to three main groups: gay men, Haitians, and people with hemophilia. As the scientific world researched further upon the disease, they noticed it had spread into communities with high rates of drug injections and into the general population as well, mainly heterosexuals. By now, most of the global world understands how this disease is spread. Now, what is AIDS and HIV? AIDS is an acronym for Acquired Immunodeficiency Syndrome. HIV is an acronym for the Human Immunodeficiency Virus. General knowledge is that AIDS and HIV is the same, which is not the case. AIDS is the condition and a syndrome in which the individual already has HIV. HIV is an infection that can lead to the development of AIDS. People get infected with HIV, which subsequently affects the body's immune system. According to the CDC, if an individual possesses HIV antibodies, he or she is HIV positive, which produces a range of diseases that are similar to that of AIDS: opportunistic infections, cancer, and other conditions associated with AIDS. AIDS is a medical diagnosis made by a physician using specific CDC criteria. Now that I got your attention, you're probably curious as to what are the symptoms of HIV. First of all, between the first 2 or 4 weeks of infection, people experience flu-like symptoms that ranges from several days to several weeks. Individuals describe it as the worst flu ever. However, there are those who do not experience any symptoms. People living with HIV may appear to and feel healthy without ever noticing their infection. However, the issue is that the infected can continue to spread the infection if left untreated. Due to the immune system malfunction, the injected are subject to other infections that would normally not be a problem, meaning that people would generally get sick easier from simple bacteria that they come in contact on a day-to-day basis. Here are some facts on HIV and AIDS. An HIV and AIDS program reported that about 35 million people are living with HIV and more than 39 million people have died from AIDS, making this epidemic one of the most destructive in history. In 2013, an estimated 1.5 million people died from AIDS, and an estimated 2.1 million individuals were newly infected with HIV. Remember, people, AIDS does not discriminate on who you are. If you don't protect yourself, it will reach you if you don't stay safe. Although substantial progress has been made with education and prevention methods about the disease to the public. In this world map, you can see that the highest concentrations of adult HIV between the ages of 15 and 49 years old is in Africa, then the Americas, Europe, fourth, Southeast Asia, Eastern Mediterranean, and lastly, Western Pacific. This was created by WHO in 2015. How to get sexual transmission of HIV? HIV can be found in semen, pre-seminal fluid, vaginal fluid, or the blood of the infected. Certain acts such as anal intercourse, vaginal intercourse, oral sex, which is highly rare, but still. Kissing, also highly rare. Sex toys, it's not very likely, but it is possible. Injections, that's very high. Sharing needles with the infected will give you a high chance of contracting HIV. Mother-to-child transmission, that happens during pregnancy, labor and delivery, and breastfeeding. Of course, there are factors contributing to infection of HIV. People are 2 or more times more likely to become infected with HIV when they have other STIs. There are 2 ways that having an STI increases the likelihood of contracting HIV. First of all, STIs that cause irritation of the skin, such as syphilis, herpes, or HPV, breaks in the skin or open sores make it easier for HIV to enter the body. The second one is STIs that do not break open the skin, such as chlamydia, gonorrhea, trichomoniasis, can increase the risk by causing inflammation and increases the number of cells that can serve as targets of HIV. Although HIV can be contracted in a single encounter, it usually takes several exposures to contract the virus. Minority races, ethnicities, and HIV. In the early 1980s in the United States, HIV and AIDS was primarily considered a gay white disease. Today it has expanded to minority racial and ethnic groups. Socioeconomic problems that are associated with poverty, housing, insecurity, and access to healthcare directly or indirectly are linked to HIV risk. For the gay community, AIDS was considered a gay disease and has the most impact on the MSM group. Epidemiologists do not know for certain how HIV first arrived in the gay community, but they do know it spread like a wildfire mainly because anal sex is an efficient mode of transmission. Furthermore, initial research, education, and prevention efforts were severely hindered by a lack of public interest in what was perceived as gay disease. Anal sex without a condom continues to be a major health threat to the MSM community. Here are some prevention tips. Be fully knowledgeable of what constitutes risky behaviors and how to avoid them. HIV screening test. Consistently using condoms effectively, as well as using treatment drugs for HIV before contracting. It has seen effective results in reducing the risk of contracting HIV. It is also known as PrEP, pre-exposure prophylaxis. Currently, there are around 30 drugs used for treatment of HIV-infected individuals. It is known as ART, antiretroviral therapy. It is a combination of FDA-approved drugs that help suppress the number of HIV cells in the body in an effort to keep the immune system strong, prolonging the life of the infected individual. Living with HIV and AIDS, you're still able to live a relatively normal life. You will just need to address the issue of effectively using ART, as well as being communicated with your partners and letting them know of your situation so they can take precautions as well.